In 2003, the United States changed the world. That's when we launched the President's Emergency Plan for AIDS Relief, or PEPFAR. The program became the shining example of what happens when we focus on helping partner countries fight disease. The year PEPFAR was launched, more than 30% of sub-Saharan Africans were living with HIV or AIDS. However, since the program began, the growth of the worldwide epidemic has been halted, and PEPFAR continues to reach out to those still in need of care and works to significantly reduce new infection rates. PEPFAR has saved lives, but beyond that, it has had significant economic, national security, and diplomatic benefits. As the 2015 U.S. National Security Strategy stated, the United States is safer and stronger when fewer people face destitution, when our trading partners are flourishing, and when societies are freer. Investments in global health contribute to all of these goals. When PEPFAR began in 2003, only 50,000 people in sub-Saharan Africa were receiving treatment for HIV, and 16 countries were facing the prospect of losing more than 10% of their population to the disease. Today, as a result of PEPFAR, more than 8 million people receive world-class medicines and are able to live healthy lives. The World Health Organization estimates that for every 8 million people given basic health provisions, $186 billion per year could be generated for the global economy. These benefits also extend to local communities. 8 million more fathers, mothers, brothers, and sisters are not subjected to a certain death sentence from AIDS and are living fuller, more productive, hopeful lives. This is strategic health diplomacy, leveraging U.S. technology and resources to make a profound and transformative difference in the everyday lives of people around the world. When deployed strategically, this can also advance our national interests. And it works. Studies show that PEPFAR has significantly improved U.S. approval rating in the countries benefiting from our help. In fact, in 2010, the average global opinion rating of the U.S. was only 20%. But in PEPFAR countries, it was almost 85%. Clearly, global health interventions are an enormously valuable tool for accomplishing our objectives, not to mention being the right thing to do from a humanitarian perspective. Today, we must build on the success of PEPFAR. There are more health challenges that the U.S. and its partners can address. The pharmacological cure for the more than 150 million people infected with hepatitis C now exists. Following last year's Ebola outbreak, critical work began that continues to strengthen the entire healthcare system in countries, thus improving responses to future pandemics. Treatment for cervical cancer, the leading cause of cancer-related death among women in sub-Saharan Africa, is beginning in 5 countries, building on the platform for care that PEPFAR established. These and other diseases, including non-communicable diseases, are presenting us with new chances to do the right thing. As PEPFAR has demonstrated, focused attention helps everyone involved. Lives are saved, human capital and local infrastructure are improved, political stability is subsequently enhanced, and hearts and minds are inclined towards the United States.